pediatrician today, and today I'm going to do a head-to-toe assessment. Can you tell me your name and date of birth?
My name is Jordan, and my date of birth is June 23rd, 2013.
Okay. The patient appears to be alert and oriented. The patient demeanor is calm, and she is appropriate for this situation. There's no signs and symptoms of distress. The patient maintains clear speech and maintains appropriate eye contact. Okay, we're just going to do a general appearance. The patient's skin is appropriate for her ethnicity. There's no evidence of any lumps, bumps, bruises, or any evidence of jaundice on the patient's skin or cyanosis. We're going to start with her head, inspecting. Her head is symmetric to her body. It is normal cephalic. Can I touch your head?
Yes.
Any pain?
No.
Okay. The patient's hair is evenly spread throughout her head laterally. There is no evidence of any bruises, lumps, bumps, or scars within her hair. Her hair is evenly distributed. Her scalp is clean, and there's no evidence of any dandruff. Okay. So we're going to continue down. I'm going to check your pulses here. Temporal pulses are +2 bilaterally. Okay, so we're going to also check her TMJ, which is also cranial nerve 5 as well. So I'm going to press down here. Can you open your mouth? Can you close it? Open your mouth, close it. So TMJ is movable and non-tender. The patient doesn't show any signs of involuntary movement in her TMJ. Okay, so now we're going to move on to her eyes. And we're going to start off with a quick eye exam. I'm going to bring it right here. If you can cover your right eye or your left eye, doesn't matter. Okay. And then can you repeat these words here?
E with D,
Oh, right.
C, F, D, H, J.
Okay. Can you cover your other eye?
C, F, D, H, J.
Okay. The patient's acuity, visual acuity is 20 out of 25. The patient that is also checking cranial nerve number 2. Okay, so now that we've done that, I want you to cover your right eye. Okay, and you tell me when you can see me wiggling my fingers, okay? Or which finger I'm wiggling. Just keep looking straight at me. Can you see me wiggle my fingers? Can you see me wiggle my fingers?
Yeah.
You can point to the one that you see me do. Now cover your other eye. Can you see me wiggle my fingers?
Yeah.
Okay, thank you. All right, so now we're just gonna inspect the eye. After we did the wiggle test, so we're gonna inspect the eye. The patient's pupils is a size 4. The sclera is white. Can I push down on your face?
Mm-hmm.
The conjunctiva is big, pink and moist. And I'm gonna push here. The lateral ducts have no drainage. So I'm gonna look in your eyes, just look straight at me. All right. The pupils react to light bilaterally. Can you look at my pen light? Okay, and follow my pen light, okay? Look at the pen light, then look behind me. Look at the pen light and look behind me. Keep looking at the pen light. All right. So yes, the patient's pupils are +4 bilaterally. They are pearler and reactive to light with accommodations and I can't think of the word, but yes. And so we've done that exam. And so now we're gonna move on and I'm gonna check your eyes using the ophthalmoscope, okay? We will have turned down the light in the room. Unfortunately, I can't do that in this video, but we will have turned down the light. So I'm gonna do my left eye to her left eye, look straight ahead. Okay? And then my right eye to her right eye. and the red reflux is present. Okay. Also, when we did the cranial gauge, we also checked for cranial nerves 3, 4, and 6. Okay, so now we're gonna look at your ears. Okay, so I'm gonna inspect your ears. Her ears are bilaterally symmetric to her face. The articles on her ears are symmetric to her face, and her pinna is also symmetric. Can I press down on it?
Yeah.
Any pain?
No.
No pain or tenderness to the patient's ears. So I'm going to also do a whisper test on her, which also will test for cranial nerve 8. Okay, so I'm going to come behind her, and I'm going to cover her ear, or she can cover her ear, and I'm going to whisper her a word.
Big.
Do your other ear.
Little.
Thank you. All right. So now we're going to do an ear exam with the otoscope. Of course, I would clean this off for my patient. So we're going to do an ear exam with the otoscope. Okay. So I'm going to look in her ear. Patient's tympanic membrane is pearly gray. The malleus is intact. On the cone of light on the right is 5 o'clock, and the cone of light on the left is 7 o'clock. Okay. So now we're going to move down to the patient's nose. I'm going to ask her to hold one nostril and take and breathe in. And the other nostril, take the other one off, and the other nostril and breathe in. Okay. The patient's nostrils are patent. Her nose is midline to her face. I'm going to check her nasal mucosa. Patient's nasal mucosa is pink and moist, and there's no signs of any swelling or drainage to that mucosa. I'm also going to palpate her frontal sinuses. Any pain?
No.
Okay, no pain or tenderness to the patient's frontal sinuses. Okay, so we're going to move down to the patient's mouth. I'm going to look into her mouth, and you can open your mouth and say, ah, ah. Patient's oral mucosa is pink and moist. Her lips are pink and moist and free from any dryness or any cracks in her lips. Her teeth are patient has all her teeth, and there's no evidence of any broken teeth. Her gums are clean. There's no evidence of any bleeding. Her uvula is midline. Her tonsils are midline, and they're not swollen or any redness or drainage to her tonsils area. There's a rising between her soft and hard palate. And I'm going to verbalize that I will put on gloves and palpate her tongue if I needed to. And right now we're going to do a range of motion with the tongue. So I'm going to ask you to stick your tongue out, to the left, to the right. Okay, put it back in your mouth. Further, further. Okay, do it again. Okay. There's full range of motion with the patient's tongue. Okay, so we're going to move back into the patient's neck area. And so I'm going to go ahead and palpate the patient's lymph nodes. So I'm going to start with the come start a little bit so we can see. Okay. So we're going to start with the pre-auricular, the post-auricular, the occipital, the post-mandibular, submandibular, submental, and then turn to the side a little bit. Okay, we're going to go down a little bit. We're going to do the supraclavicle and then the postclavicle on both sides. Any pain?
No.
Okay, lymph nodes are non-palpable and there's no evidence of any pain or tenderness. Okay, so now that we're here, I'm going to check it's your trachea, and I want you to lift your head up like this. And I'm gonna go here, my process here, and I'm gonna go up. And the trachea is midline. There's no signs of any deviation to the trachea. Okay, so we're also gonna check your thyroid, but I'm gonna go behind you to check your thyroid, okay? I'm gonna try to do it like this. Okay. All right. I'm gonna ask for you to swallow. There's no deviation to the thyroid. The thyroid moves in and out. There's no bulginess or no enlargement to the thyroid. While I am here, I'm going to listen to her carotid or palpate. Her carotid pulses are +2 bilaterally. And now we're going to auscultate that thyroid using the bell of the stethoscope. And my stethoscope is clean. No adventitious sounds heard, no groovy noted. Okay. So now we're going to do a quick range of motion with the neck. So I want you to picture your chin to your chest here. Okay. Now extend your neck back up. Turn your head to the left. Turn your head to the right. Okay. Put your ear to your shoulder, and then ear to shoulder over here. Okay. Now just roll your neck around. Any pain or tenderness?
No.
Okay. The patient has full range of motion to her neck. So we're going to continue to move on while we're here, and we're going to go and assess the patient's upper body strength and upper extremity. So first I'm going to look and inspect the patient's shoulders. Her shoulders are symmetric bilaterally. There's no signs and symptoms of any swelling, any bulginess, any disformities noted. It is symmetric to her body and even throughout. I am going to look at her elbows also. Her elbows, there's no signs and symptoms of any deformities, any bulginess or swelling or tenderness. Can I look at your wrist? Her wrist, there's no signs and symptoms of any swelling or any bulkiness or any deformities. So now I'm going to palpate her upper extremity, and I'm going to find my acromial over here, and then I'm going to palpate that shoulder. Okay. Any pain?
No.
Down, right here. Any pain? Any pain?
No.
Okay. So I'm going to do your elbow. You have to turn it this way. So I'm going to get it flexed a little bit and check and palpate that medial and lateral side of her elbow and up here. Any pain?
No.
There's no pain noted. I'm going to check her wrist. You can bring both of them up like that. So there's no pain or no tenderness noted in her wrist or any of her joints while I'm palpating her fingers. Any issues? Any pain?
No.
Okay, no pain noted. So now we're going to do some range of motion with her arms. So I want you to lift your arms straight above your head, or forward this way first, and then above your head, then like extend it back. Bring your arms here, shoulders there, good. Now bring one hand across you like this, and then back, and then the other hand across you like this, and then bring it back. Okay, roll your shoulders forward, and then roll it backwards. Now bring your arms back up like this, your elbows. Good. Now I want you to extend your elbows out, and then flex them back up. Extend them out, and flex it back up. And I want you to bring your hand like this, and I want you to pronate your hands like that, and supine, pronate, and then supine. Okay. And now for your wrist, I want you to bring your wrist like this, and I want you to bring it up. And bring it down, up, and bring it down. Right, for your fingers, make a fist, and bring it out. Fist, and bring it out. Okay. Now bring your hands back close, bring it out. Hands back close, and bring it out. Now we're gonna do your thumb, okay? So I want you to flex your thumb up, then flex it down, up, and then down. Bring your hands like this. And now I want you to press on each pinky, each finger with your thumb. Any pain?
No.
Okay, good. All right, so now that we have done that, I'm gonna do a special test where I'm gonna have you bring your hands like this, all the way out, extend, and bring your hands like that. And this is gonna be the empty can test. I'm going to push down and you're gonna push up on me. There we go. Any pain?
No.
Okay, good. All right, so now we're also gonna do another test. It's called the Tinel test. I need you to bring your hand like this. All right, and I'm gonna hit on that medial nerve. Bring your hand out. Any pain?
No.
Okay. And the next one is gonna be the Fallon test, and I need you to go like this. And hold it there. We will hold this here for 60 seconds, and if she has any pain, she will let me know. Any pain?
No.
Okay. Alright, so we have done those 3 exams, and we checked your upper body strength. So now it's gonna be time to do your cardiovascular assessment, okay?
Mhm.
So with the cardiovascular assessment, we are going to assess the patient's heart. With that being said, I will also check for my patient to see if she has any JVD. I'm going to ask her to turn her head to the right. Okay, and I will note if I see any palpations or anything there, and there's no JVD noted. If I was to measure, she would have to be laying a little bit down, like about 30 degrees down, turn her head to the right. I will measure where I see the pulsation and then add 5 to it. But now we're going to check your heart sounds, okay? So the first thing we'll do, and I am going to, if she had a tank top on, I will be able to get the spots correctly, but I'm going to try to do it above her shirt for the purpose of this video. So yes, so we're going to listen. First, I'm going to palpate and touch your heart sounds, okay? So this is going to be her aortic, her pulmonic, the Erb's point, tricuspid, and mitral. Okay. So I will have palpated those areas, and now I'm going to listen with my diaphragm. And the mitral valve, or the mitral, is on the fifth mid-clavicular line, 5th intercostal space, and that's also where the pulse or the PMI is also noted there. Okay, so after I've listened with my diaphragm, I'm going to go back and listen with the bell of my stethoscope. So S1 and S2 was heard, and the patient there's no S3 or S4 heard there. And so also while I am here, I would also check her heart sounds again with the patient turned to almost to the left side, and I would check in the same spots with my stethoscope. For the purpose of this video, I'm not going to do that for her say, but you would turn a little bit like that. The patient will also be laying a little bit down, and then I will still check in my places for the purpose of this video. I will not do that. Okay, turn it here. All right, so while I am here, I'm going to continue to check some other pulses and stuff before I move on. I am going to check her radial pulses. You can lift your hand up a little bit. Okay. Her radial pulses, which is right here. And then I'm also going to check her brachial pulse. Those are +2 bilaterally. I'm looking at her hands. There's no issues or no evidence of any like cyanosis or any discoloration to her skin. So I'm going to also check her capillary refill, which is less than 2 seconds. So I have done my pulses up here. I've already checked my carotid pulse that I did when I was doing the head and neck. So now, while I still have her forward, I'm going to check her respiratory system as well. So I'm going to check her lung sounds, but before I do that, I am going to look at her and inspect her, and there's no evidence of any retractions, any excessive muscle movements, any increased breathing or work of breathing noted. The patient is breathing, I don't want to say normal, but she's breathing without any signs of distress. So I'm going to look from her on the side here, and while I'm looking at her, her AP diameter is a 1 to 2. There's no abnormality to her chest area. I am going to also look at her from the back as well, and there's no issues, there's no retractions or anything noted. So while I am here, I am going to do her, auscultate her lung sounds here in the front before I turn her around to do her, to listen and palpate for the her back and percuss her back for her lungs for the purpose of the video of turning her around. So I'm going to listen to you in the front first, okay? Okay, so not over any bony promises, and you just take a deep breath. 1, take a deep breath. 3 will be somewhere in between here, which I can't get to in this video, but that's where her 3 will be. And then 4, take a deep breath. Okay. 5. Take a deep breath. Doing good. Take a deep breath. Okay. No adventitious lung sounds noted. I'm going to have her, for the purpose of my video, to stand up so I can show you in the back how I will assess her lung sounds and lung expansion in the back. So first I have looked and I have palpated her, and I have looked and there's no work of breathing noted. I am going to do her lung expansion from right here. Take a deep breath. And you can let it out. There you go. Okay. The patient has appropriate lung expansion. There's no evidence of any other, or I shouldn't say other, but she has good lung expansion. Okay. So first, I have looked. I'm going to palpate her back, and while the patient says 99, and that's for the tactile firmness. So I'm going to touch your back, and I want you to say 99.
99.
Keep saying it.
99.
Keep saying it.
99. 99.
Okay. So vibration was heard throughout. There was no dullness through in the back. So now first I'm going to percuss, and I will have start on her right side, and I'm going to I'm sorry. Okay. So I have percussed her back, and there was tympani found throughout, no dullness noted, and now I'm going to listen. Take a deep breath. Take a deep breath. And for the purpose of the video, I'm just gonna keep going, and so it'll be 1 and 1, 2, 2, 3, 3, 4 and 4, 5. Then I will listen to 6 and 7, and then I will come back and listen to 5, 6, and 7, according to the Bates textbook. Okay, so I have listened to her lung sounds. I am also going to listen for bronchophony, which is having the patient say, having the patient say 99 as I go through, and then I'm gonna have her say E as I go through, and I want to be able to hear E and not A, and also have do the whisper as well, and I want to be able to hear what she's saying and not, so there's no evidence of any condensations, which would indicate pneumonia. Okay. So I'm just gonna have her do 1 time in each. Can you say E?
E, E,
Say 99.
99, 99,
Can you say 1, 2,
1, 2, 3, 1,
whisper 1, 2, 3.
1, 2, 3.
Say it again. Okay. And of course I will listen into my lung sounds in the right direction. 4, 5, 6, and 7, and 5, 6, and 7. Okay. All right. So I think we have addressed all of the lung sounds and breath sounds, and so I'm gonna have you sit down for a second. So going back to the peripheral vascular, I did assess the pulses up here, but I also have to assess her femoral pulses, and I'm gonna do it here for the video. Ephemeral pulses will be right here and right here. And also her popliteal will be behind her knee, okay? And then I'm gonna just bring it up here. Dorsalis will be right here, and posterior tibialis is right here. All right, and I'm going to assess her as a patient there, but she won't be able to see it right here. And those are all +2 bilaterally. Okay. And there's no evidence of any swelling or abnormalities to her feet. Her ankles are not swollen, or her skin is still appropriate for her ethnicity, with no scars, bruises, or bumps or bruises throughout. All right, so now we're going to try to do her abdomen, and I'm going to have her lay on the bed here. And try to move this.